Good evening, everyone, and welcome. Call to order the administrative meeting of Bernalillo County Board of Commissioners for Tuesday, September 12th. I think Commissioner Talbert is expected to come. Commissioner Quesada, though, is excused. We're going to begin with a silent invocation and pledge of allegiance, and led by our Chief of Staff, Clay Campbell. During silent invocation, if you please keep in mind a couple of things. Well, actually, there's so much out there in terms of all the folks who have been impacted, of course, by the natural disasters, Hurricane Harvey, Hurricane Irma, and of course all the fires in California. So, you know, our thoughts and prayers are with those folks. They've gone through a lot. Also, I want to mention an officer, MDC officer, Christopher Gallegos, who passed away recently, and our thoughts are with his family.
Good evening, Madam Chair, Commissioners. There are a couple of changes to the agenda. So the first one is item 11A, the New Mexico Association of Counties 2018 Legislative Policy Priorities Resolution be deferred to the September 26th meeting. And the second one is item 11C, the Alvarado Square project to be deferred to the September 26th meeting. So a vote is required for the above changes.
Thank you. Is there a motion?
I moved that we make those changes.
Motion and a second to defer items 11A and C. All those in favor say aye.
Aye.
Aye. Opposed say no. The motion carries. Thank you. We have several proclamations, and so we're just going to begin that process. The first is the proclamation to acknowledge the Childhood Cancer Awareness Month. And with us today is, I've got Shauna Love, and she's with the Children's Cancer Fund of New Mexico, clinic liaison. And before I have you say a few words, I'm just going to read the proclamation. I also want to recognize Director Dee Truhecki, and she couldn't be here today, but she has spent a great deal of majority of her adult life. She lost her son to cancer, fundraising and advocating on behalf of children with cancer. And she has my admiration. She's just a wonderful woman. I'm pretty sure I have, here we go. So this is sponsored by all the commissioners, whereas every year thousands of children across America and more than 100 in New Mexico are diagnosed with cancer, an often life-threatening illness that remains the leading cause of death by disease for children under the age of 15. And whereas the causes of pediatric cancer are still largely unknown, and though new discoveries are resulting in new treatments, this heartbreaking disease continues to scar families and communities in ways that may never fully heal. And whereas this month we remember the young lives taken too soon, stand with the families facing childhood cancer today, and rededicate ourselves to combating this terrible illness. And whereas while much remains to be done, our nation has come far in the fight to understand, treat, and control childhood cancer, and thanks to ongoing advances in research and treatment, the 5-year survival rate for all cancers, childhood cancers, has climbed from less than 50% to 80% over the past several decades. Whereas researchers around the world continue to pioneer new therapies and explore the root causes of the disease, driving progress that could reveal cures or improved outcomes for patients. But despite the gains we have made, help still does not come soon enough for many of our sons and daughters, and too many families suffer pain and devastating loss. Now therefore be it resolved that Bernalillo County will continue to support families battling pediatric cancer, work to ease the burdens they face in this month. We pay tribute to the families, friends, professionals, and communities who lend their strength to children fighting pediatric cancer. May their courage and commitment continue to move us toward new cures, healthier outcomes, and brighter future for New Mexico's youth. It further resolved, Bernalillo County Board of Commissioners does hereby proclaim September 2017 as Childhood Cancer Awareness Month and encourages all residents to join us in reaffirming our commitment to fighting childhood cancer. Done this day, September 12th, Bernalillo County, State of New Mexico Board of Commissioners, myself, Stephen Michael Quesada, Vice Chair, Maggie Hart-Stebbins, Member, Lonnie C. Talbot, Member, and Wayne A. Johnson, Member. Thank you. If you'd like to say a few words.
Thank you, County and Board of Commissioners. I just wanted to say this proclamation honors those children that have gone on and have lost the battle, but at the same time, it does recognize those, as you already mentioned, that are still in the fight, and that the research is just so very important. So this awareness and proclamation is very much appreciated. Thank you.
Thank you very much. Thank you for the work that you do and for also your colleagues do every day. Very much appreciated. If you would please come around and we'll. So next is the recognition of Natural Preparedness Month. And we could have Richard Clark, our Bernalillo County Emergency Manager, and other staff come up and thank you so much, and I'm just going to read the proclamation real quick, and then if you would say a few words. This is a proclamation that is sponsored by the board, whereas emergencies, natural disasters can strike any home, any family, any place, any time. Being prepared with plans and supplies to evacuate or find shelter is one of an individual's best chances for survival. And whereas only 68% of Americans report having disaster supplies at home, 55% have a household evacuation plan, and 57% are subscribed to community alerts. And whereas each year since 2004, the Federal Emergency Management Agency, FEMA, sponsors National Preparedness Month in September to encourage Americans to improve these statistics, become involved in community preparedness. And whereas this year's theme is, disasters don't plan ahead, you can. Letting Americans know the steps ahead of emergencies and disasters before they strike. And whereas families and homes can be prepared in case of emergencies or disasters by putting together a go kit, owning an emergency kit, making an emergency plan, stocking necessary supplies, assisting with community events, and becoming trained in emergency response. Whereas Bernalillo County supports preparedness for all hazard emergency situations through detailed planning, training exercises, and equipment appropriations for response countywide, in addition to collaborating with state, federal, and other local agencies for assistance and funding in case of disasters. Now, therefore, be it resolved that to advocate citizen preparedness, the Bernalillo County Board of Commissioners hereby proclaims September 2017 as Natural Preparedness Month. Encourages all citizens to set aside supplies for disasters, plan and practice for emergencies with family, not only during September but year-round, to protect their families and homes. And it's done this September 12th, day, Bernalillo County, State of New Mexico, and Board of Commissioners, myself, Stephen Michael Quesada, Vice Chair, Maggie Hart-Stebbins, Member, Lonnie C. Talbot, Member, and Wayne A. Johnson, Member. And welcome, Mr. Clark. I'm sure you're going to tell us a little bit about the program that we are launching.
Madam Chair, Commissioners, I just want to say, just take a brief detour for a minute. We set up a plan or a program in the county to collect resources and food and water and stuff to support the hurricane victims. That came out of the county manager's office, and the county so far, we dropped off a load today at the Roadrunner Food Bank for 1,750 pounds worth of food and water, and so that great to the employees of the county. And so with that, and it was kind of strange because it hit home with me because my sister lives in Florida. Well, by the way, she lives in Sarasota, right below Tampa, and so I was on the phone with her all Sunday, and she is ready. They have a generator on their house and things like that, and so they are ready. And I was telling her, because she was kidding and sent a text, I said, show me your Go Kit, and it was like a bags of candy and so forth. And I said, well, you got to do a little bit better than that. And so what we're trying to do is throughout the entire year is we're trying to emphasize preparedness throughout the year, because you never know when things are going to happen. Yes, we don't get hurricanes, and yes, we don't get a lot of tornadoes except for in the southern part of the state, but other things can happen, such as wildfires in the East Mountains. We could have flooding in the South Valley and other things that could happen throughout the year. And so we encourage everyone to be prepared, and especially now that the winter months are coming, put a Go Kit together that you're traveling with. A small thing is a little candle can save your life in a car if you get stuck, because the warmth off that candle can help keep you warm enough until first responders get there. And those are things that we really want to emphasize. And so we're going to do a couple different programs. I think I talked about this before, but one of the programs is Until Help Arrives, and so we're going to launch that and try to push it out to different agencies. And so what we're talking about is taking action, because in a lot of cases, first responders will not be there right away, and so you could save a life by doing CPR, by doing stopping the bleeding and so forth like that. And so we're trying to push that out to the entire county to get people encouraged and motivated to get out there and help their fellow citizens and those kind of things. The other thing we talked about doing is know your neighborhoods, know your citizens, and who are the people that are wheelchair bound? Who are the people that can't get out if there was a fire or other things? Know about those, because we don't want to ever see in Bernalillo County pictures like we saw over there, where we saw people in wheelchairs and so forth sitting in water up to their waist. I mean, that's just unacceptable. And so we in Bernalillo County want to prevent that. And so this education program is what we're really about. And I know I left you some gifts, and I always leave you gifts when I come here. And so some of that stuff has to do with our 911 center and some things. And Lee, you want to talk about some of that stuff and what you do with those?
Madam Chair, Commissioners, Lee Thompson, Emergency Communications. Some of the things you have in front of you there is just a campaign to get information out on 911, because a lot of times people call 911 in their worst moment and they forget things. So what you have in front of you, you have a magnet to where people can put information and put it on their refrigerator. You have a one of those, if you have a tough strawberry jam jar at home that you need to get open, this will do you. Yeah, and also our information and our numbers are on there. And of course, if you have a tough oil cap on your car, you can use it for that too, so, And you have a couple coloring books there that we hand out to the children to get the word out on what to do in an emergency and when to call 911. So if you're into coloring, feel free. And yeah, exactly. We were at the State Fair for 2 days getting this information out, because that's important, and it's an investment in our community to get that information out there. So thank you for your time.
Thank you. Cool stuff, all this. I'm taking it to the grandkids.
Also, I want to introduce Marcella Benton. She's from the State Office of Homeland Security and Emergency Management out of the Preparedness Division, and so she has a few words to say too.
Madam Chair, thank you for allowing me to speak today. I just want to commend Richard Clark and the Bernalillo County Office of Emergency Management and their work that they've done over the last 2 years, and how far they've come with their program and what they are doing in Bernalillo County. We are extremely proud and to be working with them as our partners at Homeland Security and Emergency Management. So I just want to bring that to your attention. But in all seriousness, we are supporting Bernalillo County as well as the surrounding local jurisdictions and tribes with prevention activities. Right now, we are working with Bernalillo County in hopefully supporting Hurricane Irma with law enforcement officers that they have requested through the Emergency Management Assistance Compact. So that's something that we're working on at the state level. But as far as September being Preparedness Month, we don't want to just limit it just to September. We want to always be prepared. Preparedness starts at home. And that is where we want the local emergency managers to work with their local whole communities, volunteer organizations, private industry. their counties, their cities, and the local surrounding jurisdictions to start building that partnership so that in the event that something does happen, we have those mutual aid agreements and those relationships built so that we can properly and effectively and efficiently respond to those types of situations when we do need to. So I appreciate it, and thanks again for Richard for inviting me here today.
Thank you. Did you want to offer anything, Mr. Perez?
Madam Chair, Commissioners, it's just an honor to work next to such an incredible leader in Richard Clark. When we hired him, man, we could have done a better hire. He has really, really pushed the envelope as far as emergency preparedness and what us as Bernalillo County residents need to be prepared for. And I give kudos to Richard and his entire staff for the work that they do, along with all the other members within the public safety realm. Lee Thompson in the 911 communications, that is a job that just goes on and on. I mean, I can't even begin to imagine what it's like to sit in the seat of a dispatcher. I'm a trained EMT, and I would not want to be in a dispatcher's seat. And what Lee does every day to keep those dispatchers with what they need to get the job done is an amazing feat in itself. So just thanks to all of the public safety entities for keeping us prepared and ready to respond in the event that we need it. Thank you.
Thank you. We have some really good folks who work for the county. We appreciate you all. If you would come around and we'll give you this proclamation, take a photograph. Okay, so our next item is, if Mr. Steve McKernan could come up, please. So, Ms. McKernan, I'm just going to read this acknowledgement, and we do want to acknowledge you for the work that you have done with the county over it's still been a long time. I don't know how many years that's been, but the University of New Mexico Hospital was founded in 1954 as the largest hospital in New Mexico with 6,772 full-time employees and 629 beds, serving as a level 1 trauma center and New Mexico's only academic medical center. Steve McKernan began his 37-year career with UNM Hospital in 1980 as an accountant, eventually becoming its chief executive officer in 1996, and has served in additional positions such as chief operating officer of the New Mexico UNM Health System. During Mr. McKernan's leadership, UNM Hospital established a network of community-based clinics, has seen stability and sustainability through turmoil in the industry, and developed into a specialized and respected academic medical center. Steve McKernan announced his official retirement for October 1st, 2017, when he will assume the title of Emeritus CEO of UNM Hospital and continue to provide assistance as a consultant after transitioning through June 2018. He intends to spend greater time with his wife, children, and family, traveling across the country in his retirement. In addition to the UNM Health System, Mr. McKernan has served with the Rotary Club, the Boy Scouts of America, and New Mexico Hospital Association on the board of America's Essential Hospitals with other local community and business groups. Bernalillo County Board of Commissioners would therefore like to thank Steve McKernan for his years of service to the Bernalillo County community as CEO of UNM Hospital and wish him well on the next stages of his career. So I don't know if you wanted to say a few words, Mr. McKernan?
Thank you, Madam Chair. It has really been a pleasure to serve as in this role as the administrator of the hospital. There are only about 100 hospitals like this in the United States that are academic medical centers, flagship teaching hospitals. And of those, there's only about 20 that are both public and academic medical centers. It's really been an honor to be able to serve the community in that role. We hope we have served well and we've enhanced access and the quality of care and the outcomes for people in the community. It takes a big team of people. All the folks at the School of Medicine, Dr. Roth, and it really has been a pleasure to be working with the County Commission and the county manager and their staff. And I think we've done a pretty good job. And so I appreciate the opportunity to come down and report on a quarterly basis and keep that dialogue open. That keeps us on our toes. And I think that has improved how we have delivered care. So I really have appreciated this opportunity and want to thank you for the recognition.
Well, you're very welcome, and thank you for your years of service. And, you know, of course, we've had challenging times, and we've had challenging, conversations, let's put it that way. But we do appreciate, the work that you've done over the last years, and I know that you have the best interest of the community in mind, and certainly the hospital in mind. Someone who's lived here and understands, our community. I didn't want to just have you another plaque, so we had this little thing made. It's called a Bernie, and it's a great doorstop. And I figured it's got some use. And it says, with great appreciation, Steve McKernan, award of recognition for his dedicated service and commitment to Bernalillo County. And Commissioners, should we want to add some words?
Thank you, Madam Chair. You said Talbert, did you? Yeah.
Apologize, Commissioner Johnson.
Thank you. I wasn't going to say anything until I had my name said. I was feeling hurt. Steve, thank you for your years of service. I echo what Madam Chair just said. It's been an extraordinary experience, sometimes difficult experience from time to time, but it's always been pleasurable. And I tell you what, a lot of you don't realize that from all of the dry information that Steve has to impart to the commission on a quarterly basis, he's actually a pretty funny guy. I mean, he really has a personality, and he stands up here and gives us all this dry information. You're like, okay, Steve, are you really alive up there, or did you just record this? But he's really funny and witty, and so it's been nice getting to know you on that side of things, not just the presentation side of things. So again, thank you for your service. I think you've done a service not just to Bernalillo County, but certainly your patients at UNMH over the years, and it's been a well-run operation, despite some of the challenges that healthcare has faced and the university faces in general. You've done an outstanding job for them as well. So thank you very much for your service.
Thank you, Commissioner.
Thank you, Madam Chair. Steve, it's been great working with you. You know, when I first joined the County Commission, I used to think that I had to attend every single Board of Trustees meeting, and so I did. And so I did have the opportunity to really get a look at all the good things that University Hospital does, all the the great staff you have, all the really good initiatives to serve our community. So, again, I sometimes feel like you only hear from me when I have something to complain about, but I did want to make sure that you know how much I appreciate it, and all of us appreciate the good work that University Hospital does. I don't know if I ever told you this, but, I have a letter from you from 1994. My daughter was born at University Hospital. I think I wrote to you about something, and I got a personal letter back saying, yes, we looked into your case. This is the background. This is why it happened the way that it did. So I thought that really speaks very highly of, your personal touch. I don't know if you, and this was long before I was a county commissioner, obviously. I was just a member of the public and one of your patients. So, I was really impressed that you took the time to actually respond. So thank you for that. I still have that letter somewhere, which I will produce when I find it. But, again, just thank you for all your work. I know you'll be staying with the hospital in an advisory capacity, so look forward to working with you in the future. And best wishes in your retirement.
Absolutely, best of luck.
Thank you.
Mr. McKernan, if you would come around so we
Sure.
can give you this little doorstop and Okay, yeah, and then you could go with the National Recovery Month proclamation, Commissioner Hart Stebbins.
Thank you, Madam Chair. So I know we've got a number of people here to talk about National Recovery Month. So I'd like to invite all of you up. I know Adana Cariaga is here. I see Jennifer Weiss-Burke and David Burke. So I'd love to have you join us at the podium. I will read this proclamation and give you the opportunity to say a few words. So thank you very much for being here. This is a proclamation by the Bernalillo County Board of Commissioners. Whereas, addressing the complex alcohol, drug, and mental health treatment needs of children, youth, and families today is fundamental to the safe and healthy future of Bernalillo County. And whereas, more than 20 million Americans are living with substance use disorders, more than 90,000 Americans die from drugs and alcohol yearly, and an estimated 28,000 Bernalillo County residents have a serious mental illness, and 22,000 residents suffer from a substance use disorder. However, studies show that fewer than half of those suffering receive the treatment they need. And whereas, similar to patients battling other chronic diseases like diabetes, high blood pressure, and asthma, 40 to 60% of people suffering from substance use disorders relapse from their plan of treatment. Recovery is thus a bumpy road with multiple obstacles that require patience, awareness, and responsive solutions. And whereas National Recovery Month is a national observance held every September to educate Americans that substance use treatment and mental health services can enable those with a mental or substance use disorder to live a healthy and rewarding life. Because many such successes often go unnoticed by the broader population, Recovery Month provides a vehicle for everyone to celebrate those accomplishments. And whereas local volunteers and organizations working on recovery issues have organized Albuquerque Celebrates Recovery, an annual event to be held on September 28, 2017, that provides an opportunity for residents in recovery to celebrate their accomplishments, educate the community about their struggles, and provide resources to individuals and families seeking information about solution-based paths to recovery. Now, therefore, be it resolved that the Bernalillo County Board of Commissioners hereby recognizes September 2017 as National Recovery Month and invites all residents, private institutions, businesses, and schools to participate by increasing awareness and understanding of the challenges inherent in the recovery process. Done this 12th day of September 2017 in Bernalillo County, state of New Mexico. And this is signed by all 5 county commissioners and our wonderful clerk, Linda Stover. So I want to thank you all for being here and thank you for your work, and I'd love to hear about Recovery Month and the events you have planned.
Yes. Thank you. Thank you, Commissioner Stebbins and Madam Chair, members of the commission. I want to thank you especially for this proclamation because, you know, I've been up here quite a few times talking about people passing away of an overdose or a lot of the despair that goes along with addiction, and this is a chance for us to celebrate those in recovery. So I think it really highlights the fact that a lot of people who struggle with addiction do find recovery, and we don't often talk about that. And then it also gives hope to those that are still struggling that recovery is possible. And then so I really appreciate the fact that you guys are recognizing that and making September of 2017 National Recovery Month. On behalf, we have some of the members of the Albuquerque Celebrates Recovery team behind me, and on behalf of the entire team, which is a broad spectrum of people, I want to thank you for this recognition and for your continued support. And I also want to thank the county for being a sponsor of the Albuquerque Celebrates Recovery event, which will be held September 28th at the Convention Center. So I invite everybody to attend. It's open to everybody. It's at the Convention Center from 10 to 3, so I hope to see you there. But thank you.
Could you give us a few details of the event? Please, like what's
Yeah,
going to be
sure.
there, who's going to be there?
Well,
Who
as
should
of
attend?
today, we have over 50 tables assigned out or sponsorship tables for various service providers. So all of the managed care organizations will be represented. We have a lot of service providers in the treatment industry that will be there passing out information. We also will have food vouchers, so $10 food vouchers for the first 40 400 people that attend. And so we're encouraging a lot of people who are struggling with addiction to come, but then we also want people in recovery, and we also want community members. So if you have a loved one that maybe you just need access to resources, maybe you just want to come out and see what it's all about. It's kind of, there's a little something for everybody. We have some live art that's going to be happening. We have poetry, we have live music, we have drummers, and Adon has done a great job kind of organizing a broad spectrum of entertainment to kind of cater to everybody. So it's going to be a fun event. Like I said, free food, so everybody can always take advantage of free food.
Nice. So often when I'm out in the community, people will approach me and say, I have a son, daughter, husband, parent struggling with a substance use disorder. Is this an opportunity for people to come and learn more when they're looking for, okay, what are the resources? What do I do? Where do I go? Who do I talk to? Is this an opportunity for people in the community to come and get answers?
Yes, absolutely. This is a place where they'll be able to visit, like I said, 50 some odd booths of businesses and nonprofits and providers that specialize in substance abuse treatment services. And some are, like we'll have some that are maybe specific to reintegration and finding jobs, and some that are very specific to treatment. And so it's a broad spectrum. So everything from, maybe somebody that is just getting out of prison that might need help, being connected with people in the community, to a mother who's trying to find help for her son. There'll be resources there that they can find information on. And we're also doing Narcan training, so people can come and get Narcan trained and actually leave with Narcan. And Bernalillo County is supplying the Narcan, so I want to thank you for that. When we are also doing rapid HIV testing, Hep C testing. And linkage to treatment for Hep C. So if someone if they're embarrassed to go to a clinic and they just, they don't want to take that next step, they can come and get tested and have their privacy maintained. We'll have a separate room for people to go in.
Well, thank you. I want to thank all of you for organizing that. I think it was HAC that started that initiative.
This is our second annual event, and last year I think we planned for about 400 people, and we had about 1,500, and it was on Civic Plaza. This year it's in the Convention Center because Civic Plaza is under remodel, so we hope to have the same amount of people. But we ran out of shirts faster than we could imagine, and so this year we ordered triple the amount of shirts, and we're hoping for that everybody gets a shirt this year.
Well, there's just a tremendous demand for this information, and people don't know where to go. So here's one opportunity, and I want to thank you for making it available.
Yeah, thank you, and thank you for your continued support.
Madam Chair, Commissioners, we decided when we sat down and decided to start planning this, we decided to be inclusive and not exclusive. And so the way we plan and the providers that we've reached out to and made it available for any treatment provider in the community who wants to participate. We have medication management, so we have a couple of methadone clinics that have tables, the Turquoise Lodge, abstinence-based programs, harm reduction. We have the faith-based community also involved because for whatever reason, within the past couple of years, and I don't know if it's a local trend, but it is a state trend, but I don't know if it's a national trend, that the faith-based community has been opening up more and more recovery homes. And so we wanted to be also inclusive of them. And so Victory Outreach also does a play in the afternoon called Too Young to Die. And so we wanted to be all inclusive of that. And we all know that, I'm a person in long-term recovery. And so sometimes I feel like I'm an advocate, and I feel like I need to speak up sometimes because I'm one of many with our voice, and probably in the Albuquerque metro area, there's probably 4,000 or 5,000 people who are in recovery. And we all know that substance abuse and behavioral health, substance abuse and mental health issues are a public health issue, but they're also a public safety issue. And so the more people that we can engage into recovery, the less jail beds need to be filled. And people get jobs, and they live a normal life. They do everything everybody else does except use.
and so they become tax-paying citizens. And so we want to thank you for the opportunity, and like Jennifer said, thank you very much to the county for being supportive of our Recovery Month events. And we're just one of 11. There's 11 Recovery Months going on, celebrations going on around the state right now.
Yeah, I just wanted to add about the Recovery Month, which is a month-long celebration around the states. And it's a part of we're part of what's called the New Mexico recovery communities. So we're creating more and more communities. So the idea is to start celebrating life. And recovery is fundamentally growth through adversity. And the leaders that are coming out of the recovery movement have a lot to share with all of society. So we really appreciate your support. And we look forward to a great Albuquerque Celebrates Recovery on the 28th.
Thank you all very much, and if you'd like to come around. Okay, there's just a couple of things that I'm going to take care of. It will take just a couple of minutes, so that I'm going to have to leave early, and I wanted to make sure that the approvals got taken care of right away. First thing, if it's okay with the other commissioners, we could move 11B and 11 and 12A, which are two of the, is that correct, Julie? Two things that need to be approved, if we could put them under consent, and then we could move consent so that we get the approvals out of the way, because if I leave, then we won't have a quorum. So,
do you need a motion on
yes,
that?
we need a motion.
Madam Chair, I move that we move 11A and 11B and 12A.
Yeah, 12A.
To the consent agenda.
Motion and a second to move those two items to the consent agenda. All those in favor say aye.
Aye.
All opposed say no. The motion carries. So what I'm going to do real quickly is do the, first a couple of things. We do need to, Commissioner Johnson, if you would read those.
Thank you, Madam Chair. Offer the following statement regarding the closed litigation meeting held Wednesday, August 30th, 2017 at 3:30 p.m. Only those items described in the published notice and agenda for the closed meeting held on August 30th, 2017 were discussed at the closed meeting. I need a motion for approval of this statement, and it will become part of the minutes of this meeting.
Second.
Motion and a second to approve the statement. All those in favor say aye.
Aye.
All opposed say no. The motion carries.
I move that the Bernalillo County Attorney be authorized to proceed with the matters discussed in the closed meeting held on Wednesday, August 30th, 2017 at 3:30 p.m. within the parameters set by this commission.
Second.
Motion and a second to approve the last statement. All those in favor say aye.
Aye.
All opposed say no. Motion carries. We're going to go real quickly to the approval of minutes. I would like to
I
move
move second.
approval of the minutes of August 22nd administrative meeting. So motion and a second to approve the minutes. All those in favor say aye.
Aye.
Aye. All opposed say no. The motion carries. I next move to approve the consent agenda.
Second.
Motion and a second to approve the consent agenda. All those in favor say aye.
Aye.
All opposed say no. The motion carries. Thank you very much, Commissioners. We're going to go next to the next proclamation, and that's for...
Madam Chair, before we move on, there's a few numbers that need to be issued under consent.
Oh, I'm sorry. I always do that.
All righty.
Okay. That's for
On the consent
11B.
agenda, number E,
Yes.
2017-17
Okay.
and 2017-18.
Well,
And then we
let's
scoot
see.
over,
Okay.
and your AR 2017-55.
And
The
do
one that
this?
you moved to the consent, 11B.
Okay. Is that all of them?
That's it.
Okay. Thank you very much. Okay, the next item is, I'm going to ask Elizabeth Excel, Mission Graduate Education Manager, and Patty Nelson to please come up. Are they here? Commissioner Casada could not be here, and so I'm reading this proclamation on his behalf. And this is proclamation for Attendance Awareness Month. And just read it very quickly. Whereas good attendance is essential to student achievement and graduation, this community is committed to dedicating our resources and attention to reducing chronic absenteeism with a focus starting as early as pre-kindergarten. And whereas attendance gaps often turn into achievement gaps that undermine student, family, and community success, whereas chronic absence, missing 10% or more of school for any reason, including excused and unexcused absences, or just 2 days a month, is a proven predictor of future academic trouble and dropout rates, the effects of which can be seen in as early as 3rd grade. And whereas students from low-income families are both more likely to be chronically absent and more likely to be affected academically by missing school, and chronic absence particularly exacerbates the achievement gap that separates low-income students from their peers. And whereas all students, even those who show up regularly, are affected by chronic absence because teachers must spend time reviewing for students who miss lessons. And whereas absenteeism also undermines efforts to improve struggling schools, making it difficult to measure improvement in classroom instruction if students are not in class to benefit. And whereas improving attendance and reducing chronic absence takes commitment, collaboration, tailored approaches to particular challenges and strengths in each community, and whereas community leaders have come together to address absenteeism in all aspects of education through alliances such as the Albuquerque-Bernalillo Community Schools Partnership and Mission Graduate, and whereas chronic absence can be significantly reduced when schools, families, and communities work together to monitor and promote good attendance and address hurdles that keep children from getting to school. Now, therefore, be it resolved that we recognize the everyday matters and hereby commit to focusing on reducing chronic absenteeism to give all children an equitable opportunity to learn, grow, and thrive academically, emotionally, and socially. Be it further resolved, Bernalillo County Board of Commissioners does hereby proclaim that we will stand with the nation in recognizing September as Attendance Awareness Month, done this 12th day of September 2017. Board of Commissioners, myself, Stephen Michael Casada, Vice Chair, Maggie Hart Stebbins, Member, Lonnie C. Tyler, Member, and Wayne E. Johnson, Member. Welcome and thank you. Patty, if you want to say a few words.
Thank you. Good evening, Madam Chair and Commissioners. We really appreciate that every year you have designated and proclaimed the month of September as Attendance Awareness Month. And this is critically important as we start school because we really want to raise the awareness of the importance of school attendance. For children, school is their job, really. That said, and it's critical that students and their families set the habit of showing up at school every day possible from pre-kindergarten through high school. That said, there are a number of families and children who experience many barriers to learning, and it's really important that we understand that as a community we have a responsibility to help those students and families attend school every day possible. We also are hoping that by showing up every day and setting that habit, this will also set a habit for their work lives as well. And we hope that attendance will not just be 1 month, but all year long. Thank you again so much for doing this for Mission Graduate and for the community.
If you'd come on up and we'd give you this. A lot of recognitions today. If Deputy Justin Roybal would please come up. Bernalillo County Sheriff's Department Deputy Justin Roybal was recently honored for his work helping a local teenage girl to turn her life around. Lizeth Marquez was going down a troubled path, hanging out with the wrong crowd, fighting, missing school, and leaving home. Eventually, in desperation, her parents called 911. That's when Deputy Roybal came into their lives. Deputy Roybal returned to the Marquez home often and fostered a relationship with Lizeth that helped her to make better choices in life with the support of her parents. Deputy Roybal and other deputies took Lizeth and other teens to events, activities that helped the youth to refocus on school, while also learning new tools to tackle everyday challenges that teens face as they navigate their paths to becoming responsible adults. KOB TV recently selected Deputy Justin Roybal as one of its Pay It Forward honorees. Liz personally thanked him for caring and for helping her to change her life and reestablish positive relationships with her family and others. This is a certificate of recognition that we're honored to give Deputy Justin Roybal with the Bernalillo County Sheriff's Department, and signed by myself, Stephen Michael Casada, Maggie Hart Stebbins, Lonnie C. Talbert, and Wayne Johnson, members. Sometimes it just takes one person to turn somebody's life around, and that is really commendable. And we just want to make sure that we also recognize that as a commission. And this is a very important to us. This department is very important to us, and the folks who work for us are very important. So I wanted to recognize you, Deputy, and if you have to say a few words.
Thank you, ma'am. As much as I kind of feel like I was just doing my job, again, it's an honor to be here. Thank you for having me. I feel like I can't take full credit, though. I really need to recognize the BCSO Ghost Unit, and the gentleman sitting behind me, Detective Kyle Hartsock, and his partner, Detective Kyle Woods. The work that they do on a daily basis with victims is nothing short of outstanding. I need to thank them for their guidance and mentorship. Again, they do this work on a daily basis. Them, as well, the deputies on the high-risk victims unit, these guys deserve all the credit in the world, and we really, really appreciate your support.
Well, we appreciate you going the extra mile, which is what it takes, and this is difficult stuff. So that's why I think it's important to recognize it. I don't know, okay. Thank you very much. If you'd come around, we'd like to give you this recognition.
All right, we are now on to Commissioner Johnson, item 4F, Constitution Week.
Thank you, Madam Chair. Okay. Yes, we did. Sorry, I thought we were trying to catch up to where we are. Okay, great. If I could have some folks here, representatives of the Daughters of the American Revolution, come on down. Nancy Bennett and Gail Brooks. And I'll just go ahead and start reading this proclamation here.
Okay.
Whereas the United States Constitution was created on September 17th, 1787, to replace the Articles of Confederation set forth the United States' current system of government, and came into force on March 4th, 1789. And whereas the Constitution was drafted on Enlightenment principles and took influences from some of the greatest ideas of its time, including the Magna Carta, the Sammarinese Statutes of 1600, the Corsican Constitution of 1755, the Swedish Constitution of 1772, and works by William Blackstone, Sir Edward Coke, John Locke, and Montesquieu. And whereas the Constitution and its ideals of the rule of law, separation of powers, and the recognition of individual rights has been a timeless influence on jurists and statesmen from the United States and around the world, including movements of Latin America, independence, the decolonization of Africa, and European democracies during the Cold War, and whereas Constitution Week was first recognized by the Daughters of the American Revolution in 1955, then adopted by the U.S. Congress and signed into law by President Dwight D. Eisenhower in 1956, and whereas Constitution Week provides residents a fitting opportunity to reflect on the tenets of the United States Constitution to better understand the principles and framework of the government of the United States, which have influenced so many and become more engaged, knowledgeable, and civic-minded individuals. Now therefore be it resolved that in honor of the Constitution's creation 230 years ago, the Bernalillo County Board of Commissioners is hereby hereby proclaims.
Thank you.
Complaining would be something completely different. That's what our attorney does.
We don't want that.
We don't want that. He files complaints. Hereby proclaims the week of September 17th to 23rd, 2017 as Constitution Week in Bernalillo County, and encourages all residents to study and learn about this important document in the United States heritage. Done this 12th day of September 2017 in Bernalillo County, state of New Mexico. Signed by Debbie O'Malley, Chair, Stephen Michael Casada, Vice Chair, Maggie Hart-Stebbins, Member, Lonnie C. Talbert, Member, and Wayne A. Johnson, Member. Ladies, if you'd like to say a few words.
Our chapter is giving over 1,000 pocket constitutions to libraries, business, and students, and the students are really happy to have their own copy of the Constitution. We've received thank you notes from them. They really do appreciate that. And our Charles Dybrell chapter is honored to receive the proclamation from you. Thank you very much.
Thank you. Would you all like to come around real
Sure.
quick?
All right. This is a big night for recognition. So we are now on 4G, Acknowledgement of Bernalillo County Housing Department. So I'm not sure who from the county is here to receive this. Well, hi, Betty. It's good to have you, Betty Valdez, our Director of Housing. So I will read this and then give you the opportunity to make a few remarks. This is an acknowledgement. The Bernalillo County Board of Commissioners does hereby acknowledge the Bernalillo County Housing Department. Bernalillo County Commission would like to acknowledge and congratulate the Bernalillo County Housing Department for passing a recent and extensive audit with flying colors. Auditors working on behalf of the United States Department of Housing and Urban Development recently examined about 27,000 entries in the county's financial records and found an error rate of less than 1%. An excellent audit that sets the standard for all housing authorities. The Bernalillo County Housing Department manages 75 public housing units at 2 locations in the South Valley, including 54 units for the elderly and 21 for people with disabilities. The department also oversees numerous Section 8 housing properties around the county and about 3,000 rent subsidy vouchers. The majority of the department's budget comes from federal housing and urban development grants. Congratulations to Director Betty Valdez and her hardworking staff who do so much for the people of Bernalillo County. So congratulations, Betty. It is great to have you here tonight.
Well, it's been a long night, and there's been a lot of people up here, so I'll just say thank you.
Well, we want to say thank you to you. Again, you know, to have an audit of this quality is really exceptional. Again, you set a standard, and of course, you make the county as a whole look good, so we appreciate all your hard work.
You're welcome.
So thank you. And we have a piece of paper for you.
All right, so we have taken care of 5A. We are on public comment. So we will start with our public comment period. Julie, how many people do we have signed up?
We have 2 signed up.
Okay, and if you would read their names, anyone who signed up for public comment, please come forward. You'll have 2 minutes. A bell will sound after 90 seconds has elapsed, giving you 30 seconds to wrap up. So please read the names.
Tadna Minsky and Don Schrader.
Thank you. My name is Ted Niemiecki. I'd like to make a comment. First, how affecting Bernalillo County Commission is. Only 2 of 5 is present. I'm speaking to people, to all people in Albuquerque and Bernalillo County. That's what's going on right here. So anyway, let me get to the point. Debbie O'Malley, I don't know how long she was. Live in Albuquerque in Bernalillo County. UNM Hospital, it is Bernalillo County Hospital, where money are first, education second, patient third. That's right. That's where victim of cop shooting, dying in this trauma hospital. Now, when it comes to the sheriff, well, I have been lobbying for a lot of cameras for a long time. People spoke. Last poll last week showed 87% for against and 9 undecided. Very, very interesting. Democrats. Who are Democrats? Oh, well. Answer is communist socialist. That's who they are right here. And that's all started with community organizer Obama. And then Hillary Clinton, this psychopathic, to these days, dividing country. That's where we at. They dividing, Democrats dividing country. Thank you.
Don Schrader.
If this nation stopped stealing and hogging the world's wealth, if this nation stopped murdering moms, dads, and kids in many nations, the United States would have far less enemies. The main goal worldwide of the U.S. government, sadly, is grabbing more wealth, resources, and cheap labor by any means necessary, regardless how many millions are robbed, tortured, starved, imprisoned, and murdered. The main goal worldwide of the U.S. government, sadly, is not now and never has been genuine democracy, freedom, justice, and human rights for all people on earth. The U.S. government deliberately targets Chicano, Black, and Native youth here, seducing and recruiting them to go kill people of color abroad. Families of color here become blood invested in evil U.S. wars because of their beloved sons and daughters who are soldiers. Love for their soldier sons and daughters in danger often blinds these families and keeps them from strongly protesting evil U.S. wars. As long as most people here believe they deserve much more than desperately poor multitudes abroad, and as long as most people here crave and buy crap no one needs, the United States will rob, exploit, injure, and murder millions. But as individuals, we can choose to live simply and fairly in our world family.
That concludes public comment.
Thank you for public comment. Before we move on to the next item, I would like to state for the record that Commissioner Talbert is excused. He had a family issue to attend to, so please note that he is excused. Next, we move on to communications, and we have a presentation, the University of New Mexico Hospital Report, presented by Steve McKernan.
Thank you, Madam Chair. My name is Steve McKernan. I serve as the administrator of the University of New Mexico Hospital. We have our presentation of the quarterly update for UNM Hospital. What I thought I would do is talk in summary about it and then talk a little bit about the modern medical facility, the expansion we're planning at UNM, and take questions. To put the year in summary for UNM Hospital, what we saw was an increase in aggregate number of patients we saw in our clinics, in the number of discharges we had at the hospital, in the number of surgeries. Our emergency room volume was actually down a little bit, but that was mostly because the emergency room beds were filled with patients who were admitted to the hospital, so we couldn't have as many patients go through the emergency room. And the births were down a little bit, which is mostly a reflection of the birth rates being down in New Mexico and actually around the country. On our quality side, we saw an improvement in quality. The number of harm events that occurred at the hospital was below what it was the year before in terms of infections and falls and those type of events, so our quality improved. Our patient satisfaction improved overall. Our clinic scores were better than they had been in previous years. Our inpatient scores were better. Our behavioral health scores were significantly better, both inpatient and outpatient. And some of the top ranking scores for a psychiatric hospital that's tracked by Press Ganey in the country. The finance of the hospital were solid. We ended the year on about $1 billion of revenue and had about $15 million positive net margin, which is about 1.5%. A lot of that was related to prior year cost reimbursements settlements. We have this very complicated mechanism with the federal government for Medicare and Medicaid where they kind of pay you but not fully pay you. And then after they audit your books, then they reconcile and pay you the rest of the money. And that was worth about $10 million. On the employment side, our employment was stable. We were up about 100 FTEs in the whole organization. Our turnover rate was steady at about 14%, which is good compared to national averages. We wanted a little bit better, but it was relatively good. We were able to expand for our Northeast Heights women and pediatric clinic on Eubank and Manal, opened that up, and that has actually worked incredibly well. I know the commissioners here fully appreciate when you actually have a parking lot in which people can see the front door, they actually show up more frequently, and it works out very, very well. Community-based clinics, which is something this county commission has pushed and made a high priority, have worked incredibly well. The North Valley Clinic is working just great right now. All those community clinics are working very well. So that's a summary of all of the information that's in here. I'll be happy to answer any questions on particular data points. But the other thing that's very important is that we were able to attain Regent approval to move forward with bidding out architects for planning what we call the modern medical facility, which is about a 120-bed hospital that will go on university land, north of Lomas, east of University Boulevard, around where Tucker is and the Amafka ditch at that location. That eventually will be the site for the build-out of the whole adult facility, which can go up to eventually 600 beds, but the next iteration would be from 120 up to 360 beds, and then making sure we make an accommodation for our adult psychiatric hospital. As difficult as the main hospital is as a facility, our adult psych hospital is actually a more compromised facility, and our children's psych hospital is an even more compromised facility than the main hospital or the adult psych hospital. So we are getting those bids out, and those bids should be out in the next week or so. And we expect what will be a combination of local architect and engineering firms teaming up with national architect and engineering firms. And they will start to work on that project. We would expect it's going to be about 12 to 15 months until they deliver us a bid package in which we would be able to send the bids out. We would again look at working with the FHA on the financing of that project. It would take a little bit under 2 years to build. Then we'd have to have the building commissioned and then licensed by the state. We would expect to be able to open around July 1 of 2022 to occupy that building. So we've been working closely with the county management staff, and we'll be coordinating with them so we get input from the county. We'll be getting input from the main campus. We'll be collaborating with our partners at the Indian Health Service to make sure everybody sees the program plans and every major milestone as we go along the way, so we get input from the county and from the community and from the IHS as we do this planning. I'll be happy to answer any more questions on that topic or any of the topics.
Commissioner Johnson.
Thank you, Madam Chair. Steve, once again, thank you very much for your service. It's been a pleasure. You're getting out of here alive, it looks like. Not too many shots across your bow. So thanks again. It's been a joy to work with you.
Thank you.
So Steve, I have a couple questions.
Sure.
So pages 3 and pages 27 have some data about the title is average third available day for appointments. Can you explain that?
Yes, Madam Chair. So third available day for an appointment is a national standard. It's not an absolute standard, but what it does is what we do is randomly go through as if a patient were to call and ask for an appointment and see if you went to the third available appointment. So a patient calls in for a certain doctor for primary care. You'd see what the third available is, because the presumption is the first available isn't going to be mutually convenient for the patient. So you go to the third one down the list and you count that day. And so that'll tell you how many days to the third available, which is about 30 days for us, which is not good, but that's an accurate reflection of where we are. Now, with that said, we right now are in the position where over 20% of our patients can get a next day appointment. Even though the official way of counting is the third available, if you were to call in today, you have a relatively high likelihood of getting a next day appointment. It won't necessarily be with your physician, but it would be with a provider, frequently a nurse practitioner. It will be at the same site, but we reserve a lot of slots for that. So this one's really a reflection of a patient with their primary care provider in the third available appointment.
And is that for established patients, anybody who calls?
Madam Chair, that'll be for established patients. New
Okay.
patients is actually a little bit longer than that.
Okay. Great. And then, so I have another question that concerns the modern medical facility. So it seems for years, I saw master plans that showed all of the new healthcare facilities on the west side of University. And then I guess I read in the newspaper when the decision had been made to move at least the first stage of the modern medical facility to that east side of University, north of Lomas. When was that decision made, and what was the reasoning behind moving from the lands west to the east side?
Yes, Madam Chair. What happened is a little bit over a year ago, when the regents of the university asked management of the organization to go back and study where we needed to go on the replacement hospital. They asked for two things. They wanted alternatives for location, and they wanted a staging plan, presuming that we couldn't build the whole project at once. We sent out an RFP. We retained an architecture firm. They looked at lands west of the University Boulevard, north of Lomas, and land east of University Boulevard, west or north of Lomas. That was presented to the regents, the hospital board in April of this year, to the regents in May of this year. And the recommendation coming out of those presentations, especially with the regents, was to try and bring the hospital, replacement hospital, closer to where the School of Medicine and its building complexes were. Well, the concern was that if you went west of University, a couple of things had to happen. One is on transportation, it would require a major renovation to University Boulevard, and the university would have had to finance that. Effectively, you'd have to build a bridge on University Boulevard so you could get people, traffic and everything within the university from where the School of Medicine and the main hospital is now to where the hospital, that location would have been between the freeway and University Boulevard. And when we walked that down to the city wasn't real excited about that project and said that would be something that the university would have to carry. And we'd have to develop that whole space between where the School of Medicine is now and where the new hospital would be. That was going to be a very expensive project. The other thing that the faculty started to express significant concern about is physically moving back and forth. I think, as you know, Madam Chair, the university's made a significant investment in the educational facilities right on Stanford. And some of the research, the next phases of the research facility are also in that neighborhood, where in front of the old OMI and in that part. So what the university was seeing is, in the long run, over 30 years, that site west of University might work, but between now and then, so much of the investment was on the east side of University. They believed that keeping the hospital on the east side of University would work better. They asked the architect to see if you could design up to a 600-bed hospital in that location. So from Lomas all the way up to about where KNME is, from the Amafka Ditch to University Boulevard. They were able to provide plans that said you could get up to a 600-bed hospital. You could get all the clinic facilities. You could put 2 major parking facilities in that space. And most big teaching hospitals tend to top out at about 600 beds. Then they go on to build a completely another facility. So the regents accepted that plan, and then they, a little bit over a month ago, gave permission for us to go bid the architects on that. I know that's a long explanation, but I thought I should give background on where we are on that.
No, that was actually, I really appreciate that, all of the detail. The one thing that I would ask, I do represent the neighborhoods that surround that area. I think that there probably is going to be an additional impact, or I think that the new location will impact the nearby residential neighborhoods more than on the west side of University. So I just hope that you're doing outreach to the community, to the different neighborhood associations in that area to discuss the traffic impacts that the new location
Thank
could
you,
have.
Madam Chair. We will make sure we do that.
Thank you, I appreciate that. Before you go, anything else we should know? Anything you've always wanted to say and just haven't?
If you're asking me if there's anything, anything.
You can say anything you want,
We'll
provided.
have you back.
Under FCC
regulations.
Yeah, but it has nothing to do with the hospital.
Sure.
You are blank check.
As a biker, I would like a connector between the Balloon Fiesta, where the Balloon Fiesta bike path stops, and Tramway. That would be one of the safest things. Also running a trauma hospital, that would be one of the safest things I think you could do, because people going the North Amafka Ditch could go all the way out to Tramway, and they wouldn't have to go through the roundabout, all those bridges and all that other stuff down there on the road out to Bernalillo.
I mean, Paseo del Norte doesn't quite cut it for you?
No.
That was a joke, everybody.
We can work on that. So I thank you for that suggestion. Would you also like us to do an underpass under Indian School at the North Diversion Channel? It's the only one on the North Diversion Channel trail where you actually have to get off your bike and.
Yes, as a biker, that would actually complete. If you could go from the university to Tramway and never have to face traffic, because as a biker, there's too many ghost bikes that are out there right now.
Yeah.
They're just too many people are getting hit, is too dangerous, and it's just not safe, and we see too many people in our trauma room. And I would thank you very much for offering me that opportunity, and that's what I would say.
We can work on that. And you know it's going to be the Steve McKernan Memorial.
Oh, no, not memorial.
Not memorial.
A memorial means there's going to be a ghost bike up there for me. I don't want to go there.
It's going to be the Steve McKernan underpass or whatever those other things are called. But thank you for that suggestion. We will take care of that for you.
I appreciate that.
Thank you for being here. All right, so we have concluded all of our business except approval of the minutes. We'll have to move that to our next meeting because we did not vote on that, but we have.
I believe we did move on that when
did
Commissioner
you move on
O'Malley
the
was
minutes?
here. Yes.
Excellent, all right, then we are finished with our business. The next Bernalillo County Administrative meeting will be at 5 p.m. here in the Vincent E. Griego Chambers, Tuesday, September 26, 2017. We have signed all documents that require our signature, and this meeting is adjourned.